Okay, so guys, listen, this is for you. Moms, wives, daughters, this is for you too, because you're the smart ones. Isn't that right, doctor?
Yes.
The ladies are the ones who get us into the doctor, like you, to check things out and to find out if everything's working, including our prostate. That's what it's about. Oh no, don't say, I don't want to hear about that today. You better hear about it because we've got some important news for you. Dr. Howard Tay here. Fred Taylor is back. Look, when it's working well, what does my prostate do? Why is it there?
Well, the prostate is there because it's an organ in which it helps with the reproductive system.
Yeah.
And if you can surmise it as like an orange that sits underneath your bladder where the tube that the urinary flow goes through is a straw, normally it's just a passive tunnel where the urine flows through. But during reproductive aspect with ejaculation, the prostate closes and allows the semen to come out.
Well, you certainly got all the guys' attention there because we want that to work, don't we, Fred?
Exactly.
Yeah.
And when it isn't working, what do you know about that, by the way?
Well, when it's not working, then that's when you have to go see people like Dr. Tay and find out why it's not working.
Well, why are you so interested?
Well, I'm so interested because there's been some unfortunate guidelines handed down recently that are going to determine or impact men greatly across this country.
What guidelines?
One, as it relates to the PSA exam, they're moving, instead of being screened every year, they're recommending every 2 years. They pretty much wiped out the utilization of the DRE, which is the digital rectal exam, and this is what we have right here.
Well, go ahead and show it like that, and then we'll have some idea of what we're talking about.
What the doctor is doing when he does the DRE is to feel for these nodules. If you feel nodules on the prostate, then there's a problem. And this exam, the doctor can determine this within 15, 20, 30 seconds. And if you feel a nodule the size of a marble, we know that you have big time problems, and you're going to have to do something about that.
Doctor, it's 2013, and the minute you say rubber finger glove to any guy, they automatically start heading in the other direction and say, we'll talk about that later. Isn't that true?
Yes, that is true, and I think that the key important aspect of this conversation that Fred brought up is quite often, there's been a lot of focus on the blood test called the PSA to screen for prostate cancer, but another important aspect of screening for prostate cancer is doing a prostate exam. Quite often what we're seeing is that patients who have more aggressive form of prostate cancer may have a normal PSA level, but then when the doctor actually completes the other part of the exam, which is to do a prostate exam, they may find a lump on the prostate that would require a biopsy. Another important aspect that I think is becoming to the forefront is the whole push that the pharmaceutical companies going for the use of testosterone replacement. And that in itself can generate a whole another ticking time bomb of patients who may develop prostate cancer as a result of not being screened properly. And that would lead to more cases of undiscovered prostate cancer.
So by the very fact, though, that now we are told that we don't have to get the traditional test more than once every couple of years, are you saying now it's even more important that we get the digital exam too?
You get both exams. We're doing a screening on September the 28th with Dr. Che with Arizona State Urology. We give both exams, the PSA, which is the blood test, the DRE, which is the digital rectal exam. If you come to us, you get both exams. And if you don't want both exams, go somewhere else. But I advise you to get both exams if you are in fact concerned about your health.
Yeah, but if you go somewhere else, they're liable to charge you, and this is free.
That's correct.
Free prostate cancer screening scheduled for the 28th of this month, and remind everybody where it is.
It's going to be at Arrowhead Hospital Complex, and that's 6320 West Union Hills Drive, Suite B as in boy, 1600. That's Glendale, Arizona, 85308. You can call us at 602-547-3806 or email us at swprostatecancer, and we'll get you signed up.
Now, no matter what it is, doctor, you in particular as a medical practitioner know, whatever the condition is, there are myths associated with it. What about prostates?
Well, I think that the key important aspect is that not everyone who has a problem with their prostate has prostate cancer. I think that's the key thing. But the awareness of knowing your prostate health and knowing whether or not there is some prostate cancer there will give you the information necessary to make the right decision for treatment if that's needed.
Is it also a myth that if you get prostate surgery, if you have your prostate removed, you're instantly, automatically impotent for the rest of your life?
That is definitely a myth. With the technologies that we have available, using a robotic device to remove the prostate, quite often it is quite capable of preserving the sexual function of a male, the erectile function.
Now, the free screening is the 28th at Arrowhead, but you can get information year-round all the time at the Southwest Prostate Cancer Foundation, and you're liable to run into Fred Taylor there, and if not, Dr. Howard Tay is also available just to answer your questions about that little thing that causes so many problems when you just don't know what's going on. This is the Morning Scramble